You now put in brackets right anterior chest. So the impaired skin integrity is localized at the right anterior chest, which is related to disruption of skin surface secondary to burn injury. When using secondary to divide the etiology into two parts to make the diagnostic statement more descriptive and useful, it usually follows a pathophysiology or disease process or medical diagnosis, e.g., risks for decreased cardiac output related to reduced preload secondary to myocardial infarction. Here, the cause is myocardial infarction, which now leads to reduced preload and now make the patient to have risks for decreased output. This secondary to make the nursing diagnosis more descriptive and understandable. Unknown etiology can also be used as a related factor, but it's not quite acceptable in exam. So you can use it when the signs and symptoms are present, but you do not know what triggers it, the cause or contributing factor. Example, ineffective coping related to unknown etiology. I repeat, don't use it in exam. Complex factors can be used as related factor too. It is used when there are too many factors you want to just gather together and put it in a brief phrase, but please don't use this in exam. It can only be used in real life experience. How to form nursing diagnosis from exam question. We have two types of question formats used in an exam. Example, the question that contains signs and symptoms of the patient. Mr. Lekan, a 45-year-old casual alcohol user, was brought to the medical emergency unit of your hospital with the history of weakness, loss of appetite, yellowish skin, itching, and fatigue. On examination, a diagnosis, this one is medical diagnosis, a diagnosis of liver cirrhosis is made. Develop a nursing care plan to solve 3 nursing diagnoses of Mr. Lekan. So the nursing diagnosis of this question format is easy to form because it gives you hints about the signs and symptoms the patient presents. The second question format is the question that has no signs and symptoms or hints. This one is kind of difficult because you have to think critically to figure out the signs and symptoms of the medical diagnosis of the patient before you can form your nursing diagnosis. Example, Mrs. Z, a 45-year-old woman, was admitted into the oncology ward with second stage of cancer of the cervix. Develop a nursing care plan to solve 3 nursing diagnoses of Mrs. Z. You have to list the signs and symptoms of cancer first before you can form your nursing diagnosis. Number 1 tip is you have to know the question format. Second, if there is no hint in the question, there is no signs and symptoms presented by the patient, you have to create one. Tip number 3, arrange the signs and symptoms in order of priority. Most life-threatening symptoms or signs should come first, especially those that affect the airway, breathing, and circulation. Tip number 4, whereby enough signs and symptoms is given, do not consider using a risk factor during exam. Tip number 5, form the nursing diagnosis according to the signs and symptoms given to you. For example, the questions I read before, you get to see like about 5 signs and symptoms that were given in the question. Okay, just because you crammed acute pain, anxiety, and others does not give you the right to use them when they have given you a scenario of the signs and symptoms the patient presented on admission. So you have to make use of the symptoms that was given to you in the question to form your nursing diagnosis. Okay, let's form the